Hello, my name is Jacqueline. I'll be performing a physical exam on you today. How are you doing?
Good.
Great. General survey of the patient is their appearance is clean, the effect and mood is appropriate for this setting, and the skin color is appropriate for the ethnicity. I'm going to start with the abdominal assessment, first by inspecting the skin and looking for any asymmetry. So if you could please lay down for me. So we're looking for any asymmetries, distension, and peristalsis just off the bat. So I'm just going to uncover the abdomen. Okay, and so far the abdomen looks good, appropriate. Then there is nowhere that is protruding more than the other side. Next, I will auscultate the bowel sounds in all 4 quadrants. We are listening for 5 to 30 bowel sounds per minute in each quadrant. Under 5 would indicate hypoactive bowel sounds. Over 30 could indicate hyperactive function. Next, I will listen to the vascular sounds after in the abdomen, listening to the abdominal aorta, the renal arteries, and the iliac arteries. So I'm going to first listen to all 4 quadrants. So ideally you would listen to all 4 quadrants for a minute in each quadrant. Okay, and bowel sounds are present in all 4 quadrants. So now I will listen to the aorta, the renal, and the iliac arteries. And we're listening for a bruit. A bruit can indicate a partial obstruction of an artery. So now I will percuss in all 4 quadrants. We're listening for tympanic sounds over the stomach and epigastric area, where we're listening for dullness over places like the liver. So I'm just gonna, that's tympanic. So she's tympanic in all 4 quadrants. Now we can percuss the liver, and we will determine the size of the liver, which should be, for the liver span, about 6 to 12 centimeters. I will percuss above the liver areas in the mid-clavicular line to assess for size and area of dullness. For this, okay, so the liver, it came to about 6 centimeters here. And now I will percuss for the spleen. We're looking for spleen enlargement. We want this to be tympanic. Dullness can indicate enlargement. So I'm going to go over the anterior axillary line over the last intercostal space, listening for tympany there. Okay, and now I'm going to have you take a deep breath. And we want it to still be tympanic. Dullness can indicate that there is an enlargement in the spleen. Now we will be doing light palpation. I'll be going into the abdomen about 1 centimeter deep, assessing for any masses, tenderness, or swelling, pain, or rigidity. And now I'll be going in for deep palpation, which is about 4 to 5 centimeters deep. I'm feeling for internal organs, masses, and again looking for pain or tenderness. Any pain or tenderness that you're having?
No.
Okay. Now I will palpate the abdominal aorta, which is right about here. Okay, it is palpable. For the abdominal aorta, we are looking for an abdominal aortic aneurysm, which would be a strong pulsatile mass cell. Now we will palpate the liver border, which is just below the costal margin. Okay, and I'm going to have you take a deep breath, as this will help move the liver downward and can help make it more palpable. And it is palpable here. And now we will palpate the kidneys with ballotting, one hand above the costal margin and one hand below the back. Okay, and palpate on the other side. Ideally, I would have her turn the other way, but for the video's sake. Okay, and now we will inspect if you can now sit up, please. Okay, sorry, I'm just collecting my thoughts. Now we will, oh, sorry, I've missed palpating the spleen. If you could just lay back down again, I'm so sorry. So now we will palpate the spleen in the left upper quadrant, and we'll place our hands under the left costal margin, and we'll palpate with deep pressure while the patient takes a breath. Can you take a breath, please? Okay, and the spleen is not palpable, which can be a normal finding. All right, now I will, if you could sit up, please, and I will inspect the upper extremities. Thank you for that. So now we're looking at the clavicles, and I'm going to look at the scapula and the shoulders. We're checking. We're checking for any symmetry, any asymmetry, and she is symmetrical along the back there, and her clavicles are also symmetrical here. And we will palpate the joints, feeling for any crepitation. So if you can just move your arms out for me to the side. Okay, and put them down. Okay, no crepitation there in your knees. Kick them out. Okay, and no crepitation that she has. And now we will check for range of motion and strength of the neck and shoulders and the elbows. So can you nod your head up and down? And yes and no. Okay, perfect. She has range of motion in her head. We'll check for strength. Can you push your head against my hand? Thank you. Push your head against my hand. Thank you. Okay, and now she has good range of motion and strength in her head and neck. Now can you shrug your shoulders? Okay, the range of motion in shoulders. Now push against my hands. Great, and she's strong. And now for your elbows, can you just bend them out for me? Great. And now keep them up. Push against my hands. Okay, great. Oh, you're very strong. Push against my hands. Great. And now I will check the hands range of motion. And now can you just give me a little spin of the hands? Great. And now squeeze my fingers. Great. Her hands are very strong, and they're strong bilaterally, which is very important to test for. Now I will test the reflexes of the biceps, brachioradialis, and triceps. We're looking for symmetry on each side, and we're looking for hyper or hyporeflexia. Okay, so you can just put your arm on mine, and I'm going to check right at the brachial tendon. Great, she had movement there. Now we will check the brachioradialis. Great, she has movement. And now we will check the triceps. Great. Okay, we'll check the other side as well. So, great. Great. And, all right, she was equal on both sides, and she had normal reflexia on each side as well. Now we will check we will palpate the radial and the brachial pulses. So, brachial, radial, both are +2. And we're going to look and inspect the hand and palpate it for any abnormalities, any lesions, any nodules. And we're going to check the fingers for any clubbing or any splintering in the nails of the fingers. Okay, and there is none of that, so everything looks good. Now I'm going to have you lay down again, please. We're going to palpate the hips and check for range of motion. We will palpate the hips at the greater trochanter. Any pain or tenderness, and I don't feel any popping, and they feel equal on both sides. And now I'm going to check for range of motion. If we can just move your leg up, bend your knee. Great. And we'll do that on the other side. Move your leg up, bend your knee. Great. Okay. And now we will move on to the lower extremities. We're going to be inspecting and palpating the lower extremities, looking for symmetry, evidence of any muscle wasting, and I will check the knees for range of motion and strength. So if you can sit up, please, for this one. So if you could just bend your knees, push them against me, push them against my hands. Great. Now push them against my hands. Great. Very strong. Okay. So knees are very strong here. And now I'm going to palpate the pulses. So I'm going to check the popliteal. Dorsalis pedis. And posterior tibial pulses. Okay, those are all intact. And Now I will check the Achilles reflex, which I will dorsiflex the foot. And we're looking for her foot to dorsiflex as well. Okay, great. They are equal on both sides. And now we will check the Babinski sign or the plantar reflex, which I will take a blunt object, such as the end of this, and rub it against her foot. And we are looking for the foot to plantar flex, versus in a child, we look for it to dorsiflex and the feet to go in. So the adult's plantar flex, and we look for the toes to fan out, which it did on both sides for her. And now we will assess the spine, looking for posture if there's any kyphosis or lordosis or abnormal curvature in the spine. All right, so I'm just going to have you stand up, please. Okay, no kyphosis or lordosis, bend over. And ideally we would be looking at the spine here, and I'm just going to palpate it. We're checking for muscle symmetry on each side. Okay, great. And no evidence of scoliosis, lordosis, or kyphosis. You can sit back down now. And now we will do, actually you should still stand up. We will do range of motion now. So if you could touch your toes, please. Great. And bend over like this and stretch back. So we were checking for flexion and extension there, and it's intact for her. And now go to one side and go to the other side. And now twist and rotate. Okay, you can sit back down now. Now we will go on to our neurological assessment, where we will be checking for cranial nerves. So cranial nerve 1, we're going to identify an odor. What do you smell?
Coffee.
Great. And then we will check cranial nerve 2, visual field. So if you could cover one eye, please. And I'm going to also close my eye and tell me what number I'm putting up.
1, 2, 3, 4.
Okay, cover the other eye. Ready?
1, 2, 3, 4.
Great. Okay, and that is cranial nerve 2, that is optic fields. And then cranial nerves 3, 4, and 6, we're going to check for extraocular movement. Perla, can you blink, please? Great. And now can you just don't move your head, just follow this with your eyes. Okay, I'm going to shine a light in your eye twice on each side. We're checking for Perla. And there is constriction and accommodation. So Perla is intact and extraocular movements are intact. So that means cranial nerves 3, 4, and 6 are intact. So now we're going to test for cranial nerve 5, facial sensation. And I'm going to check the masseter and temporal muscles. Okay, great. Those are intact and they're strong. So now I'm going to just touch the face slightly. So close your eyes, please, and tell me when you feel something on your face.
No. No. No.
Okay, great. So cranial nerve 5 is intact. And cranial nerve 7 tests for facial movement. If you could just smile for me, please. All right, and Okay, great. And for hearing acuity, I will do the whisper test. Repeat after me the numbers I'm saying. 1, 2, 3.
1, 2, 3.
4, 5, 6.
4, 5, 6.
Okay, and if she failed the whisper test, we could perform tests like the Weber or the Rhine test, which we have previously performed. And now I will be testing for cranial nerves 9 and 10 for palatal movement and swallowing. Can you just swallow for me? Okay, and just Okay, great. And we're going to check the trapezius and the sternocleidomastoid movement right here. If you can just squeeze for me here. Great. So cranial nerve 11 is intact, and cranial nerve 12, tongue movement and strength. So I'm going to take your tongue depressor. If you can stick out your tongue. Push against. Great. And now, and push against. Great. All right. Tongue movement and strength is intact, so cranial nerve 12 is intact. So now we're going to do rapid alternating movements. Can you flip your hands over quickly, like this? Great, rapid alternating. And now we're going to do the same thing with your toes, but you're going to touch your toes to my fingers. Great. Great. Now we will do the heel shin test. So this is testing for a possible lesion in the cerebellum, and if the patient was unable to perform, that's what we would further eval. So if you can take your left heel and graze it against your right shin. And now do the same thing on the other side. So now those were equal symmetrically on either side. Now we will check for exteroceptive sensation, which will be light touch and dullness versus sharpness. So I will first do light touch with this cotton swab. So if you could close your eyes, please, and just tell me when you feel.
No. 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 No.
Okay. And now we're going to check for sharpness versus dullness. So tell me when you feel something dull versus something sharp.
Dull. Sharp. Dull. Sharp.
Okay, great. So she passed that test as well. And now we will check for proprioception. So if you can continue to keep your eyes closed, I'm going to move your finger up and down, and when I stop, tell me if it is up or down.
Up. Down.
Okay, great. I'm just going to test on this side.
Up. Down.
Okay, wonderful. Now we will check the vibratory test over bony prominence. And this, we will start distal to proximal. And so we can start on like the toe. So do you feel that?
Yes.
Okay, great. And we'll go to the knee. You feel that?
Yes.
And if she said that she did not feel something distally, we would continue to move our way up until she did feel something. And we can check that on the other side. You feel the vibration?
Yes.
And you feel the vibration?
Yes.
Okay, great. And now we will check for cortical sensation. I'll put an object in your hand with your eyes shut, and you're going to tell me what it is. Okay, so close your eyes, please. All right, now open your hand. What is that?
A coin.
Great. Okay, and now we're going to do palm graphesthesia. So I'm going to write a number on your hand with your eyes shut still, and you tell me what it is.
1.
Okay. Great, she passed that, and we're going to do that on the other side.
1.
Okay, great. And now we're going to do 2-point discrimination, and I'm going to use these 2 Q-tips. I'm going to put them together so they're slightly apart like this, and I'm going to touch her with either one or 2 sides of it. So tell me if you feel 1 or 2 things.
1. 1. 1. 1. 1.
Okay, so she did not pass that exam, so we can further evaluate from there. Now we will check the extension test and keep your eyes closed. Tell me if both sides or one side is being touched.
Both. Left. Both. Right.
Okay, she did pass that exam. Now we're going to observe you standing, walking on heels, tiptoe, and heel toe. So I want you to just give me a couple steps of regular, a couple steps on your tiptoes, and a couple steps you're going to heel toe. Okay?
Mm-hmm.
And we're looking for any abnormalities in the gait, any preference to one side, or just any inability to do the task. Okay, wonderful. Thank you so much. And now we're going to check the Romberger sign, which you're going to put your feet together for me and cross your arms against your chest. And we will have her stand like this for about 30 seconds first. And then I will have her close her eyes. And we will check for any swaying, anything if she's going to fall over. So for this test, especially if you do think your patient might fail, you want to make sure you're close by to catch them, so just in case they do fall. And she did pass this Romberger's test. Great, thank you. And now we will check for pronator drift. So we will do the same thing. If you can just put your arms out straight first, please. And now close your eyes. So we're checking for one of the arms to drift, or both. And we're going to make sure they can stay up equally. This can indicate a problem with corticospinal tract if there is an issue. Okay, great. All right, and that's the conclusion of our assessment. Thank you so much.